One thing I really wish people knew about Austin Area Birthing Center is that we're here to partner with your body in birth, and we're not treating you for a pregnancy, but it's really about coming alongside you and your body and basically just helping it along if we need to. If not, we're just kind of along for the ride right with you. And so it's not about the treatment, but it's just about the partnering.
I think what I want people to know about the Austin Area Birthing Center is that we provide safe care here. I think a lot of people are kind of misinformed about what a birthing center is and what a midwife is. And of all the practices I've worked at, like, we definitely are up there in terms of our standards and the quality of care that we provide for our patients.
There's people who don't understand what maybe a birth center is or maybe what a midwife does. And so for people who are just kind of getting their curiosity piqued, knowing that yes, we do prenatal visits just like you would at an OB's office. We're doing risk assessment, we're listening to baby, we're doing all the same kind of blood work and screenings and testing. It's just starting off pregnancy and labor and birth at a lowest intervention rate for low-risk people.
I wish that they knew how calm and peaceful it can be at birth. It's very different than hospital birth, and I think a lot of people aren't aware of that.
I wish people knew that birth really isn't something that is a medical condition that you need to treat often. There are cases when you need the hospital setting, you need that medical intervention, but for a lot of patients, it's a really great place to have a baby because you don't need that high level of care, you don't need to stay multiple days. It's something cultural in the United States that we do with birth, but we can treat it more normal and then address those complications as they come up.
Birthing at the birth center doesn't mean that you don't have access to any type of pain medication if you were in labor and desiring that. We have herbal remedies that we use for relaxation and pain relief, but we also have more traditional pain relievers that we can use in the process of labor. And then we offer nitrous oxide for relaxation during labor too. So I guess it's not all or nothing. I think it's kind of a blended approach to labor and birth.
Just that out-of-hospital birth can be safe if we have low-risk moms and low-risk babies and well-trained midwives and birth assistants. And also because we're plugged into the hospital network, like we have excellent collaborative relationships with the midwives and physicians at the hospital, that if for some reason your pregnancy and birth is no longer low risk, we have an easy way to get you into the higher level of care that you need.